Good afternoon. Good morning, West Coast.
Good morning, good afternoon, good evening. Welcome to today's webinar. We are going to be talking about the acceleration of patient empowerment and consumerism in the healthcare field.
It sure is accelerating,
It
isn't
is
it?
all happening. So welcome. If this is your first time joining us, we are diving deep into our Healthcare Marketing Trends Report for 2024. If you don't have your copy yet, you can head over to our website, smithandjones.com/ebook/trends to download your copy today. Or if you want a beautiful hard copy, you can get in touch with us. We'd love to mail you one. But 2024 is the year of disruption, and we're going to be talking about a lot of these disruptions today. And today is focusing on our trend number 1, all about consumerism. And if you're joining us live on Zoom, please feel free to type into the chat and let's make this a two-way conversation with your questions and comments. We would love to hear what you think.
And if you're watching this on demand, please feel free to email us or put notes if you're watching this on social media at a future date. Love to hear from you.
So a quick introduction to our authors of the report. We have Elisa Barone, our VP of Brand and Content. Katie Source, that is me, marketing and content strategist. We have Paul over here, up there, our vice president and lead strategist at Smith & Jones. And we have our friend Jared Johnson from Shift Forward Healthcare. You know him, Healthcare Rap podcast. You know him from all of the conferences. So a really great person to be working with on this report.
Always great to hear from Jared. If you've been to a healthcare conference in your lifetime, you probably have seen him if you listen to the Healthcare Rap podcast. He has a fabulous think tank, and he's also shared some points of view on this. I know certainly consumerism in particular is a topic really interesting or of interest to him. So we were happy to have him help contribute to this year's Trends Report.
And if this is your first time tuning in with us and you haven't heard about our Trends Report, we've been putting this out for the past 11 years, actually. And the goal is really to provide actionable tips and takeaways for any size team at a hospital or health system. And Paul, do you want to tell us a little bit about the methodology?
Yeah, so this is, as Katie mentioned, we've been building year over year. In fact, it'd be great to look back, maybe do a retrospective. Did we get it right for the last 11 years? But it's not just the opinions of the authors that you saw here, but this is essentially what our clients are talking to us about, asking us about, worrying about. These are the things that are keeping folks up at night. Each year we conduct dozens and dozens of email surveys, focus groups, interviews with industry thought leaders. We are attending conferences at some fabulous venues, MashMed, ShishMed, NESHCO. In particular, among a lot of others, this year we're going all in on Sway Health. I hope to see you folks in Atlanta this year. And it's either what we're presenting at these conferences or what our other presenters are talking about. We do a lot of social listening. We have some great tools that help us aggregate content and information. Even things like Google Trends just give us a sense of what's happening and what's in that zeitgeist. Is your SAT word of the day. But it's really just that entire thing. We kind of ask ourselves toward the end of each summer, what's happening, what's on everyone's mind, what are the themes and issues that we're hearing and talking about. And with that, I think our next slide even kind of summarizes the topics that are in this year's fabulous Trends Report.
Yeah, so like we said, disruption is here, and the overview of the trends that we chose for 2024, consumerism, which we're talking about today, the importance of understanding your patient journey, the importance of using patient-centered language, of course, the rise of AI, and the ongoing workforce challenges that we're all facing. So today we're going to be talking about trend number 1, acceleration of patient empowerment and consumerism. I know it's a mouthful, but Paul, why don't you get us centered and let us know, what do we mean when we talk about consumerism?
Yeah, let's get on the same page. I think for so long, and for some of us longer than others, some gray hair over here on the left side of the stage. We've been speaking about the folks that we serve as patients. You know, it's a very common term, and yet sometimes it feels less equitable and inclusive. It feels subordinate to the physicians and the healthcare providers. And as Katie mentioned at the beginning, there's been this incredible acceleration and rise in consumerism, certainly over the last several years, but it's been something that's been happening for decades. And I think it's important, and part of, I think, if you take away nothing else from this presentation, don't stop watching now, but if you take away nothing else from it, it's shifting our mindset as healthcare marketers from thinking about the people we serve as patients and genuinely true empowered consumers. So to get on that same page, Jackie, why don't you roll the first video, and we'll kind of, this is a great summary from Michigan Medical School that really kind of summarizes what is consumerism.
Increasingly, healthcare is being viewed as a consumer good. And this is being driven because patients have more skin in the game. They have increased costs related to their healthcare. Increasingly, employers are giving them responsibility over choosing their healthcare, over purchasing their healthcare. And the impact of this consumerism on us is that increasingly patients will be shopping for lower cost services. When we provide services, we'll increasingly be asking questions about the cost of the treatment plan. That will require that physicians spend more time with patients explaining the benefits of the care that we're proposing. We're likely to see a decrease in the utilization of healthcare. We'll likely see more bad debt because people have increased responsibility, may not be able to afford the cost of their healthcare. And we're likely to see less compliance with recommendations. They may not fill a medication that just is too expensive for them. For us as an organization, we need to demonstrate to our patients that we provide value.
So the impact of consumerism to hospitals and health systems, but really I think, and what we'd like to explore in the next few minutes and through a few more video clips, is what's really fueling that consumerism. There's a number of different factors, and some of these go back 20 years that are really driving and creating that shift, as you heard a moment ago, from patients to consumers who think about healthcare as essentially a product, a commodity, something that they could get in different places, or because of the cost, sometimes defer or don't get. So many of you, and actually I pulled this graphic from a presentation that we had given in 2004. And at the time, it was probably a little bit more relevant. We had decided then there was this spectrum. Not all healthcare consumers are equal. And their level of empowerment varies. On the right, you have what we called at that time the just fix me's. These are people that basically say, here's my symptoms. Doc, you went to medical school. Tell me what's next. And they put all of their faith and care into what their healthcare providers are directing or telling them. On the other end, and at the time, for those of you that remember Murphy Brown, it was the lead character in a sitcom, but she was a very strong-willed, very empowered consumer who was taking control over healthcare decisions in her life. You know, and the storyline in that part of that season of that show, you know, really talked about people that, you know, were opposing her point of view, challenging her point of view. She was going to have a baby at the age of 42, but she had a very strong-willed, very well-informed, she was a journalist character. Love to get a chat to Katie's point. If anybody's got a more recent example, is there a character or something, you know, out in the public, you know, an example that we could use that might be a little bit more contemporary, but it's something I love bringing up again because it's perhaps still relevant now, 20, 30 years later. So at these extremes, and what we're seeing is this shift to more of these Murphy Brown types of personalities, these more empowered consumerisms or consumers. So we're going to go through in the next few minutes a few different news clips and brief video clips, and in particular some of the technology that's empowering consumers. And for this one, we're going to go back even farther to 1998. Jackie? So WebMD, 1998, it was really one of those first, and those of you that have seen these presentations from us before, we've talked about this. This was that first seismic shift. This is where patients could type in symptoms and start to understand a little bit more about the potential for their diagnosis. And that was the first shift away from the physician's education and specialty and started putting information in the hands of consumers. That was that first step forward into the tech space. But as Katie can tell you, there's a lot of other things, even more recently that's fueling empowerment for consumers.
Yeah, I think that just the access of information via the internet and now social media is one of the biggest driving factors in this. The fact that people can not only learn, medical information, but can learn from each other. So people have the ability to share their experiences on social media, whether it's with a particular health system or doctor or just in general, that people didn't have 20, 30 years ago. And I don't think people talked about health, whether that's physical or mental, as much as they do now, and they feel comfortable sharing it with people in real life or even to strangers on the internet. And, as the token millennial, I have to bring up TikTok, but I think TikTok has been a huge tool in fueling patient empowerment since 2020 when it started really taking off. I've seen a lot of people sharing their stories, on things like the Adderall shortage that's happening now, on mental health, on, like women's care services, and just spreading knowledge so then the people watching it can then become empowered and can talk to their doctor about these different things, and just having more knowledge about these services and things you can do, things you can ask for. Knowledge is power. So I think that's huge, and that's going to keep impacting the health system.
Yeah, and whether that knowledge, to Katie's point, is in the form of really deep, robust articles on WebMD, if it's in the form of quicker, more digestible content on places like TikTok, certainly there's wearable technology. We got it, right?
Yeah.
That can warn me that I might be having an irregular heartbeat, that I might be, in or out of my fitness goals. I can join healthy communities through my fitness, like on Peloton. Online communities, looking at online reviews, we'll talk about a little bit more. But all of these tech advancements have been accelerating tremendously. And I think the advancements, for instance, on the Apple Watch over the last couple years, are putting a lot of information, excuse me, in the hands of consumers. So the next theme that's empowering consumers are high deductible health plans. So for that, let's watch this next clip. Jackie?
This was a fascinating article for me for two reasons primarily. One, the sheer quantity of people that have these high deductibles, the workers now. So explain that. And the second thing is how few people can afford an emergency $400 check if they need one to pay for medical fees.
Right. So what we've seen is that over the past roughly 15 years, a huge number of American workers and American families are now in health plans where they're responsible for the first $1,000 or $2,000 or sometimes $5,000 or $6,000 of medical expenses before the insurance plan starts kicking in. Now, there are trade-offs to that. It means premiums are lower than they would be if the plan was paying for the first dollar of coverage. But it also means this whole layer of risk has been put on employees.
And as Julia said, there are employees who can't afford it.
Yeah, there's a lot. And what's interesting is that the shift to high deductible plans kind of coincided with deterioration of American household finances. This took place during the housing crash, the financial crisis, and the kind of period of wage stagnation. So there are a lot of families that can't afford emergency medical expenses.
And so this even builds on the comment that you heard about consumerism in our first video clip. Patients having more skin in the game. This is what was said by Michigan Med earlier in our presentation. And again, I think that's what's fueling a lot of patient empowerment. They've got more skin in the game. They're actually now responsible for the cost, and they're making decisions based on those expenses. I'm lowering my monthly expenses, but now I've got higher cost per transaction or these deductibles. And so patients are doing a number of different things, which we'll talk about, I think, in the next video. But Katie, anything you want to add to this?
Yeah, the other side to this that I think goes hand in hand is the idea of the value-based care versus the fee-for-service. And I think that like we desperately need to be moving into the value-based model. And again, with the internet, with things like TikTok, people are realizing that Americans spend much, much more on healthcare for worse clinical outcomes in countries that are similar to us. And people are realizing this isn't okay. This isn't how it should be. So the value-based care ties the amount that healthcare providers earn for their services based on the results they deliver to their patients, such as quality, equity, and cost of care. Under the fee-for-service, healthcare providers, like physicians and the hospitals, are paid for each service they provide. So they're rewarded for volume, not results. And yeah, with people able to share their stories on the internet and people from other countries even able to chime in and say, oh, well, this isn't how our country does it. We're able to get these things for free. You know, people are realizing that it doesn't have to be this way. And this isn't a new concept at all. Like, we've talked about this, the shift from fee-for-service to value-based reimbursement, actually in our 2017 trends report. But as inflation is getting even worse and care is even harder to pay for, I think this is going to become a bigger and bigger issue because people are just not going to be able to afford care. And that's a major, major problem.
And I think those cost implications and the costs that are passed down to patients, healthcare consumers, is what's going to give rise to the next couple things we'll talk about that are fueling consumerism. First is the demand for price transparency. And you'll hear us talk in the next couple videos a bit about Walmart. And this next clip is from 1991 from an interview where actually Sam Walton was being recorded at a presentation. Really interesting for those of you that are familiar with Walmart Health, and we'll talk about this, I think, in one of our next clips. Walmart is always about always low prices. That was the mantra. It always has been, always will be. But as Walmart steps deeper into the healthcare space, they're bringing that philosophy with them. So for those of you, southern states, central, even some of the western states where Walmart Health is gaining traction, you know that when you walk in there, there's a price list. What is an x-ray going to cost me? What is my strep test going to cost me? And there is information at your fingertips that doesn't exist in most contemporary hospitals and health systems. And watch this next clip for a second. It might be a little bit harder to hear, but it was already captioned online. So let's watch that and we'll come back and comment afterward.
Health benefits the hospital. We've got to get the hospitals and doctors in line. We've got to get those charges under control. I've made it a point to find out every time I have something done, and get it done all over the darn country. I'm embarrassed. Nobody wants to tell me how much it's going to cost. When I crawl to one of those x-ray machines or get something done. I did yesterday, and just give you an example. Here at base, I went into this MRI machine, and I said, as I was going in, I said, how much is this going to cost me? And the guy looked kind of startled me. He's running one of these mobile machines. He runs one of the big still. He runs one of Rogers or somewhere else. Can you hear me back there all right? I don't want to get too hoarse, but he said, well, I know what we charge. I said, well, I want to know what the hospital as well as you folks charge. So I finally got it out of him. Well, there's one procedure I was going to have. He charges $500. And it took about 25 minutes. Then he says the hospital adds $250 to it. And when he got me through, he said, this is what you're going to die about. No, I didn't say that. I knew I would die. But he said, this is what's going to kill you. He said, this brown medicine I'm squirting in your veins costs $78. We charge $78 for it. The hospital charges $255 on top of that. That meant my 40 minutes in under that thing cost me about $1,000. And it meant that the hospital didn't do a thing to get them into town and got half the money. Now, what it means is all that These people are skinning us alive, not just here in Benton. And they're doing it smilingly, and they do it with you know, they're charging us 5 or 6 times what they ought to charge us. Not that much, but more. So we need to work on a program where we've got hospitals and doctors and workers' comp and our pharmacies gaining and saving our customers money and our employees money. And we haven't even started to do that. And if we don't get it done this year, I'm going to get real upset. I'm real upset.
Well, you know, that's Sam Walton. That was 1991. Kind of sure that Walmart would probably have those same percentage markups on some of their services that and products that they provide. But I think the core of what Sam was saying is essentially people want to know what things cost. You know, it shouldn't be a fight to find out or to learn what it is going to cost going in or a surprise afterwards. Obvious exceptions, especially emergency care, you know, there's just not the time or capacity in some cases to learn what's happening. But again, as patients, now consumers, have more skin in the game, they want to know what things are going to be costing, especially because they're responsible for that first $2,000, $4,000, sometimes $6,000 in expenses.
I mean, the fact that we've been having this conversation since the 90s is really fascinating and a bit upsetting, right? But I do have a little bit of good news. So in 2022, so last year, 70% of hospitals have complied with both components for the hospital price transparency rule, up from just 27% in 2021. So things are trending upwards, which is great. And CMS did fine 12 hospitals in 2023 for not complying. So I think hopefully this is going to keep improving. That's why they have the rule. And I have some thought starters or questions on this. You know, how can marketing get involved in price transparency conversations to help make the language as clear and concise and digestible to the common person who's going to be reading this? Because if you're putting information out there but it's not clear, you're not really going to be helping people. So this is why plain language, which is our trend number 3, is so important. Making sure that you're putting out information that everyone can understand and get the information that they need is so important.
Yeah, and we should jump over trend number 2 next. Let's make plain language our next webinar right after the first of the year. So we'll go through a couple more themes, but to Katie's point, the last few slides that we have for you are those implications for marketers. We're not all gloom and doom, you know, but we think it's important to help inform everyone on the factors that are giving rise to and empowering consumers. And then, as I said, we'll flip over in the last few minutes of our presentation today and talk about those implications. What can hospital and health system marketers do about it? So the next topic is online reviews and ratings. And again, this is going beyond just the health grades and leapfrog, those expensive things that we're tempted to and sometimes pressured to, you know, purchase on behalf of our health system and put a sticker in the window that says we're a top 50, top 100 U.S. news, whatever it could be. But it's going a lot deeper in that. And we're learning over the last, certainly decade, that consumers are paying less attention to these third-party reviews and more attention to each other. Jackie?
A hospital for your surgery or a retirement home for your loved ones are important decisions, but they're not easy to make. So ABC Action News reporter Lauren Rosella is taking action for you tonight, explaining how Yelp can now help you decide.
Yelp says they're adding this to help consumers make better decisions in very critical times, but advocates warn you need to do more research. There's so many factors to consider in picking a care facility or hospital, like quality, cleanliness, the staff, even the food. Now, consumer review website Yelp is aiming to make that easier.
We give just another layer of information that can help guide their really important offline decision.
Yelp is now using state inspection reports from Medicare.gov to rank these medical facilities.
If you can take this information and put it into a context that makes more sense while they're in the middle of making that decision, then it's a win-win for a consumer.
So there's Yelp stepping into a space that we never really thought beyond restaurant reviews and destinations, but they're actually aggregating and sharing third-party quality data and helping put that in the hands of consumers. We're seeing this in things like Google reviews that are more sort of community-based, Facebook where people are crowdsourcing information, really a number of different areas.
Yeah, again, as the as the millennial, like, if a healthcare facility doesn't have reviews, that's kind of a red flag, right? But then if they do have reviews, people are more likely to leave a review when they're mad or upset. So it's really difficult, but I do feel that, like, this is something that can't be ignored. It's something that you really have to be on top of and responding to all of your reviews, even if they are negative, and having a plan for that. And if you want to learn more about this topic, we actually have a full webinar on our YouTube channel on managing online reviews and ratings, and it includes tips for, like, responding to reviews and how you should handle them. So I definitely recommend checking that out because, yeah, having a review strategy is something that needs to be a dedicated job, whether it's, you know, it might be between marketing and customer service working together, but it needs to be someone's dedicated job. It can't be an afterthought, because people are going to be seeing these reviews and they're going to be seeing if you're responding or if you're not responding. And something as simple as that could have someone saying, I don't want to go there, let me go here instead. So it's definitely really important.
So up to this point, we've talked about all the information that is fueling consumer empowerment, the cost burden that's passed on to the patients, the information that they have at their fingertips to help inform them about the symptoms they might be having, the disease that they've been diagnosed with. We've talked about how they can compare through reviews and see, you know, what their options are. But let's talk for a second about even more options that are available. We're starting to see a number of different organizations stepping even deeper into the healthcare space than they had been before. Walgreens, CVS have been in that pharmacy side, but, maybe stepping into immunizations, but now going all in through billion-dollar acquisitions on primary care. We've seen Amazon, a number of different organizations, and I promised you another clip on Walmart. So, Jackie, let's roll that.
My name's Kunal Gupta, and I'm a physician here at Walmart Health.
My name is Catherine Chiari. I'm a nurse practitioner.
My name is Britt Miller. I'm a care host.
I'm Charlotte. I'm a nurse practitioner here at Walmart.
When I came to Walmart Health, I felt right at home.
I became a nurse practitioner because I love caring about people. I come here every day feeling empowered to provide excellent quality of care to my patients.
Here at Walmart Health, we never want to compromise quality. We're able to provide on-the-spot care for patients, being able to get results pretty much instantly.
When I come to work every day, I know I'm going to be touching people's lives. I know I'm going to be helping people.
One of the things I've definitely been able to enjoy is that work-life balance.
I feel like the kind of care that I give here is what I've always wanted to do.
If you're looking for a great job where you get that work-life balance and rewarding experience, you should really come join us at Walmart Health.
So that was a recruitment video, but I think the point of that is we could have turned the volume off and it would have looked very much like a lot of the videos that we produce on behalf of our hospitals and health systems. Point being, there's a lot of services that are being offered at these retail clinics that are challenging and becoming sort of those feeder points that hospitals and health systems usually enjoyed. They're displacing urgent care centers, many urgent care centers that are part of a hospital or health system infrastructure. It's become very, to Katie's point, wait for it, disruptive. And it's happening on a geographic basis. We're in upstate New York. We've got a lot of interesting and challenging regulatory environment. But in the southern states that we also spend a lot of time in, we're seeing these ramp up tremendously. Certainly there's questions about the perception of quality. What is it that, what's the role of Walmart, for instance, in my life, and what would I trust them with for my healthcare? But there's a significant part of the population that appreciates accessibility, transparency on the price sheets that are available. Google it, Walmart Health price sheet. You'll see it. It's every possible procedure. And when you think back to what you saw in that commercial, the diagnostics, the conversations, the settings, all of them feel very much advanced, compared to the hospital environment. So they're accelerating and becoming a very attractive alternative for consumers that are looking for either quicker or faster transactions and access as they go through that process.
Yeah, and on the marketing and communication side, I feel like all the retail clinics are fully leaning into the ease and simplicity. They have online scheduling, they can get you in and out, they have price transparency, so they already have these things baked in that a lot of traditional hospitals and health systems are still struggling with. So what I want to pose to you is to think like, can you really compete with what they have to offer? And I think you seriously need to think about this. Do you want to compete with them? Or would it be better to partner with them and then instead lean into the things that they can't do and they will hopefully never be able to do, like the specialty care, surgery, inpatient care, these bigger things? We've seen a lot of traditional health systems partnering with CVS and with Walgreens and putting their, branding alongside those brands. So I think that's something that we're going to be continuing to see in the coming year, these partnerships where they're realizing that people want to have these things. Let's partner with them so we can give it to them without having to do so many things internally that would be difficult to do. So something definitely to think about.
And so the point being, consumers have options, and they have options that are familiar and perhaps even sometimes more accessible in their lives. So take all the empowerment, all the education, the price transparency, the crowdsourcing, the comparative tools that they've got, and now they have more options than just the traditional hospital and health system. If you have questions about or concerns about the quality of healthcare that might be associated with the Walmart brand, Dollar General has a chief medical officer. More on that in a future podcast. And we'll talk about quality perceptions in a couple more videos. But going back to tech for a second, let's talk about telehealth. Certainly that is something that gave rise. It grew slowly but was accelerated tremendously by the pandemic. Let's watch this video clip from very early 2020, which I believe is still extremely relevant today at the end of 2023. Jackie?
The emergence of this new virus and issues around social isolation, quarantining, people being nervous about their economic security and their health has created a whole new surge of demand for mental health services, unlike what the system has really seen before in the last few weeks and months. The U.S. government moved quickly, and they started making it possible for people to use teletherapy and video-based chats with their own therapists in order to give more people access to care in a quick fashion. And a lot of insurers have followed suit, adding some new free services covering co-pays for mental health in a way they haven't before if they're starting to feel depression, anxiety, or substance abuse problems that may be new to them or may be aggravated by the isolation they're feeling. So there's been a lot of positive momentum. Companies like Talkspace are seeing a 65% surge in demand for their services.
So again, this is something that's been accelerating. This is something that consumers came to rely on during the pandemic for socialization, but now embracing it, perhaps even closing some of the gap that folks might have in more rural communities, assuming they've got good access to broadband. But Talkspace, Doctors on Demand, all of these platforms are consumers are very comfortable with these, for certain types of procedures, especially the rise of mental health issues over the last couple years, and something that is, again, fueling the empowerment that we see consumers having.
Yeah, like things like Talkspace and BetterHelp, like they're not going to go away. So I think like it is so important to not just have telehealth, but tell people that you have telehealth, or if you have a partnership with your insurers who offer it. I've seen that as well, just getting it out there that you have these things available to your patients. And I've also seen a lot of advertising around hims and hers for getting, anxiety medication, women's health, men's health things. So again, more choices that, I don't actually have to call to make an appointment with my doctor. I can do this all online. So do you have that ability to do it online, and do people know about it?
And with all these different options that healthcare consumers have, whether they're the retail clinics, these telehealth options. We're going to be doing a future webinar on the hospital at home model that we're seeing nationwide that's ramping up tremendously and becoming very popular, whether it's urgent care delivery or support services where these programs are partnering with the hospitals. To Katie's earlier point, you don't necessarily need to compete head-to-head against these organizations, but in some cases, maybe it's better to be partnering with them as an extension of your delivery. And so the last clip that we wanted to play as that summary of all the things that we see that are empowering consumers, that are shifting people from being more passive patients to much more empowered consumers, is a concept that may not be familiar to many. And we kind of put it in that category of getting your health care from a brand like Walmart, but medical tourism. Jackie, what's medical tourism all about?
Panama is not the only popular destination for medical tourism. In Colombia and Vietnam, hip replacements, one of the most popular surgeries, average less than $10,000. In the U.S., $50,000. The same can be said for heart bypasses, as little as $11,000 in Malaysia or $25,000 in Israel. In the U.S., $144,000. How much would these treatments have cost you, these implants have cost you in Atlanta?
Well, the lowest price I got was about $27,000.
And in Panama?
In Panama, $7,000.
So about a quarter.
About a quarter.
In terms of the quality of care, many of the doctors that cater to visiting Americans were educated in the United States. They now work at hospitals affiliated with some of the most reputable institutions in America, including the Cleveland Clinic and Johns Hopkins University Hospital. Its affiliated hospital in Panama City is run by Dr. Moises Zebedee.
When we started our practice here, we say we need a hospital that has the level that we have our training.
Zebedee says medical care in Latin America includes aftercare with a private nurse and recovery time at a nearby resort.
I do rounds every day, room by room, to touch and see how the patient's doing.
For some people, traveling abroad for medical reasons is not just a money saver, but a way to receive treatments not available at home.
So as we were preparing for this presentation, Katie and I were doing the, sort of chatting about what we wanted to cover, whatever. The question was raised, is this a concept of the last resort? Is this the last resort you should, consider when all other expensive options or anything else? To which I replied, yes, but that looks like a resort, and I would like to recover there. This idea that you might actually have a single dedicated one-on-one nurse that supports you in all of your post-operative recovery in places like that with physicians that are trained in the United States at costs, as you saw by comparison to what this one the one patient was able to find out something cost $27,000 in Atlanta to compare it to $7,000 cost in Panama, and then receive that quality of care from somebody that could be very comparable to what you might find in the United States, can be very attractive. Again, to that point from Michigan Med earlier in this video, patients have more skin in the game, and when the cost is as significant as we saw in this video clip, patients are making these choices increasingly so.
Yeah, this is just kind of sad. Another thing that's sad that, we shouldn't have to do this. But, yeah, I think most people don't want to do this. I mean, there might be some people who might want to get their procedure and take a vacation. But I think most people, don't want to resort to that. And so what can you do? I mean, it all goes down to building a relationship with your community, building that trust so they don't want to go anywhere else. They know that they have these services available in their community. Educate them about why it's better to get care at home in your community, be around people you trust and family. So yeah, just keep building that relationship over time. And it is like an over time, maybe even over a whole lifetime relationship building.
Yeah, I think in general, people don't necessarily want to consider these options, but if these hospitals got more aggressive and spoke to the depth of care, the attention, the time spent with healthcare providers, the dedicated healthcare providers, and the cost differential, I think you'll see increasingly folks wanting to move to that. In general, to Katie's point, communicating your quality, communicating your presence in the community, neighbors taking care of neighbors, that's something that these other institutions can't necessarily compete with. So in summary, up to this point, access to information, cost, because of high deductible health plans, a demand for that price transparency, the ability to compare through reviews and ratings, increasing options, whether it's retail clinics, hospital at home, telehealth, or even going overseas for procedures. All of this is fueling that consumerism movement, and it's disrupting the work that we've been doing. It's disrupting the position that our hospitals and health systems have traditionally held, and part of the reason why, it's one of our themes, and theme number 1 of this year's Trends Report, speaking about our, naming 2024 that year of disruption. So in the last few minutes, I want to introduce you to that new patient, and then we want to give you some implications and tips for marketers to go through pretty quickly. Bringing our friends back on screen here again, as you've seen, there are less these just fix me's and more of those Murphy Brown, empowered, strong-willed, and demanding personalities, taking every experience they've got offline and in other environments and applying that to healthcare itself. Again, they're shopping online for information, they're looking for quality outcomes, whether that's something that they go and seek directly or it's packaged to them through Yelp, as you saw in that previous video. They're getting recommendations from either online ratings or their social networks. Going to the hospital is no longer the only option for treatment. They've got a lot of other things that they can be considering, and some of those may or may not be those entry points, within your system and your organization. Increased financial responsibility. They've got more skin in the game. And again, they've got that, care and convenience in most cases. Now, that's something, to Katie's point, that's preventing them from going overseas or crossing borders for healthcare. But depending on the nature of the procedure and what your backlog is, and fueled by our, workforce shortages, we only have one bariatric surgeon, and so we can't get to you for 6 or 8 weeks or over the summer. And again, Panama, recovering at a resort. I'm broadcasting from upstate New York. It was 19 degrees this morning. It's kind of nice, actually. So what are some of the implications for marketers? What can you do to tackle some of these things head on? Patient-centric marketing. A one-size-fits-all generic message is no longer enough. Develop these patient-centric approaches, and these don't have to be expensive programs or projects to implement. But the more that you've got authentic testimonials, whether you're sharing handwritten notes or putting patients down and just hearing from them in their own words, no teleprompter, unscripted, information, putting out your providers as those subject matter experts, their thought leaders, and using them to share some of that educational content, whether it's something as quick as a medical minute or blog posts that they're contributing to. Having them just riff for a couple minutes while somebody's taking notes or while a camera is rolling can be incredibly easy and efficient, and something that can be done, frankly, on an iPhone. And then, beyond that, being very interactive and responsive. You've got a lot of tools that are available through your chatbots and direct messaging and things like that. But the more that we can be patient-centric in our messaging rather than talking about our hospital, organizing our website like an org chart within the institution, but understanding what the patient and now consumers' needs and wants are and meeting those demands.
Yeah, and Paul, just touching on the educational content really quick. I was just writing a blog, having to do with AI, and we'll talk about this more in another webinar, but with the amount of AI written content that's going to be coming out there, people are going to be a little more untrusting, I would say, of health information. Like, is this actually legit? So you using your doctors and your medical professionals and being very clear, saying this is who vetted it, this is who reviewed it, this is all above board, so people can trust the information that's coming from you is going to be huge. So use your people to your advantage, and that will set you apart from other AI content that might not be as thoroughly researched.
The other thing is digital engagement. Again, folks are, spending increasing amounts of time online, and whether it's through apps or searching the web for information, considering as part of your 2024 plan and beyond, as Katie mentioned earlier, those increased investments in telehealth marketing, or if you're doing it and felt like, we launched that in 2020, make sure that that's something that's, promote it as much as you're promoting your own brand and service lines, letting folks know that they have that option. Investing in online communities, creating, whether they're closed Facebook groups for bariatric support, conversations, or cancer survivors, or whatever else it could be. That should be part of the mix again. Mobile optimization's kind of a no-brainer. Most of us are doing that anyway, but it's always good to check in on the site and make sure that it's loading and performing and kind of easy and friendly. If you have the opportunity, look at your team's org chart, within the marketing team specifically, and having somebody that's dedicated to social media. Again, the conversations that are happening that you may want to either participate in, clarify misperceptions, or have somebody quickly able to respond to, hey, I'm looking for, I wonder if, etc. And in the automation, this is Katie's area of expertise, through all of your automation conversations, the more you can get one-to-one with patients, dear Paul, dear Katie, here's some information for you, and trying to avoid that one-size-fits-all newsletter that goes out to everybody, but really segmenting conversation between different types of groups, all keeping it very hipporific. Transparency and trust. I think that's at the root of a lot of this. Folks want transparency in price. They want trust in quality. To Katie's point, now everybody's skeptical about what's happening. But building that trust, comes through that clear, open, direct, and honest communication. Certainly creating education through things like video and webinars, dedicated section online on your website, or brochures for pricing and billing policies. If you're not able to accurately and consistently, develop that sort of price structure, price ranges, at the very least have billing policies in place, letting folks know so that it minimizes the surprise about what's going to end up in my mailbox a few weeks after my procedure. And even beyond that, allow me to connect with a human being if I have a question. There's going to be nothing more frustrating than not knowing what something costs, being surprised by the expense, and the frustration of not being able to find somebody afterwards to help me at least understand it, schedule payments, negotiate it, whatever it could be. And I think those are the moments that define a patient's perception, a consumer's perception of your hospital and health system brand, more so than the clinical interaction. Some of that is the cost of doing business. You better have the best docs, you better have the best technology, but if I'm irritated because I'm waiting too long in the waiting room, I can't get in touch with somebody over billing, those are the things that are going to hinder your ability to grow through word of mouth. Transparency and data reporting is also important, especially outcomes. The more you can put that stuff out there in terms of success rates, great. But again, and I mentioned this earlier, buying those third-party ratings are rarely helpful. We've done hundreds of focus groups with patients and prospective patients. We've asked, what influences your perception of a brand quality? When you think about hospital XYZ instead of hospital ABC, and you think that they're better than the other ones, it's very rarely can anybody cite, oh, they're a top 100 by US News, they're a 5-star health grades, they're a whatever. It's all word of mouth. It's their personal experiences within the organization, and it's those customer service things. I'm no longer surprised that when I get into focus groups and I say, when you think of one organization and compare it to another, and you think this one is better, I used to think, oh, they've got the best docs, they've got the latest technology, etc. And now it's valet parking, quick access to appointments, I can reach a human being on phone, they spend time with me as a patient. All of those things are pushing that, resist the temptation or the pressure to buy into some of those programs unless you're coming out of a crisis and you need to quickly sort of up your rankings, in which case you may want to shout that pretty loudly. But we're seeing it less important as far as consumerism goes.
I think one interesting thing, going back to the video and webinar side, so during COVID, there were a lot of organizations that their CEO or one of their leaders was doing daily video updates. And obviously that's something that you definitely don't have to do, but just that they were being so open and communicating directly with their communities is a really good practice to have just in general. So if there is ways that you can weave into your plan throughout the year of your leaders, if it's your CEO or another person, just being out in the community and being transparent and explaining things. Why did this happen? What is this new building about, or this new program? Like, talking directly to your community, I think that that's huge. So something to think about.
Yeah, and I think to Katie's point, in COVID, we were smart. Once a week, our CEO went before, the community and said, here's some updates. This is what's open, closed, vaccinations not. Here's the status of things. We're performing these. We're locked down on these. We're not performing these procedures. But what if those conversations continued? What if I could hear from leadership within the organization? Doesn't have to be the CEO, but every week, hearing from somebody that said, you know what, I just want to share a thought, folks. I walked through my waiting room this week and here's what I saw. And I thought my patients want more, they deserve better, and we're working on this. I just want to let you know that I'm aware of it. Let's not worry so much about those giant policies and monumental changes within the organization, but imagine a leader within an organization, he or she goes before the camera once a week pretty quickly and just says, I'm thinking a little bit more about parking.
Yeah, whatever. I think something as simple as that could just go a long way in building trust.
Yep. So messaging that innovation, again, with modern consumers being more tech-driven and fueled by that, the opportunity for marketers to emphasize the innovative technologies, the services that are available, how those are going to improve patient outcomes and experiences, whether it's valet parking that you're offering to robotics, all of those are part of what consumers are expecting, and make sure that that's part of your story just as much as you might be talking either generically about your brand or specifically about a particular service line that you want to highlight. So putting that out through featured stories, perhaps, case studies, testimonial videos, virtual tours and webinars, even real-time updates on social media. Hey, some of the most popular content on TikTok is watching people unbox something. I've never seen an MRI unboxed, but could be kind of fun in a time lapse. Right? Yeah, we should try that. And then lastly, I think this is our last slide, but data privacy and security. So as Katie mentioned before, again, AI has given rise tremendously. We'll have an entire webinar dedicated to that in the coming months. But there's data out there. Data breaches are in the news every day. People want to understand that their information is not only secure, but understanding what your organization's policy is on the whole GA4, HIPAA, that'll be another conversation for us for another day. But reminding patients that, this is our policy. This is anonymized patient data. We can publish our data privacy online, and I think that's important. But why don't you give patients, to Katie's point, a very plain language 67 or 60-second video where I can go through and say, look, I can read these 67 pages of what's happening on this privacy policy, but give it to me in a nutshell. Hearing from somebody who is your chief information officer and having her walk me through to say, hey folks, I'm so-and-so. Here's what we do with data. Here's how we protect your data. Here's how we use and don't use your data. If you want to learn more, read on, send me an email, etc. But talking about this on webinars, on social media, and just kind of really getting out there ahead of the skepticism and concern that folks might have. And to Katie's point, that's what it takes to build trust. So thank you for joining us for this. Thanks for sticking with us through the whole thing. We hope you've got a better sense of, this rise of consumerism, what's fueling it. We hope you're in that mindset of understanding who your new patients are and, what their needs and wants are, what their expectations are as they're coming to your organization. But in general, we think you've got a tremendous opportunity. We as healthcare marketers, the leaders within that sort of voice of our brand, to lead that charge. We are the ones that can tell that story in a very patient-centric, to Katie's point, very value-driven way, ultimately helping benefit your brand and the industry as a whole. So thank you again for joining us. This won't be the last webinar we do. We're looking forward to 4 more trends that we have during the course of the year. We hope to see you and hope you'll see us at some of the upcoming conferences. We're going to be at MASHMED and SHISHMED and NESHCO throughout the course of the year. There's a couple other ones that we're potentially speaking at. If you're watching this on demand, please drop us a line if you have questions, comments, opposing viewpoints. We'd love to have a spirited dialogue and debate on all of the things we're sharing. In the meantime, feel free to download it or reach out to us for a custom copy. We'd even autograph it. Give us your name. Tell us all the people in your department. We'd be happy to send it out. So on behalf of all of us at Smith & Jones, thanks for joining us today, and thanks, Katie.
Yes, thank you, Paul, and thanks everyone for joining us.